This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG Lafredo, and this week I'm coming to you from KRMC's Wallapai Mountain campus. I am at Kingman Orthopedics and Sports Medicine, and my guest is Dr. Francesco Sinopoli. He is a doctor of chiropractic here. Hey, Dr. Sinopoli, welcome back.
Thanks for having me.
Thank you. Thanks for having me. I'm here in your office. It's been a long time. We talked when you first started with KRMC, but it's been a while, right?
Been about several years, since we last spoke.
Can you remind me, when was that?
I believe it was late 2015 or early 2016.
So you're at something like 7 years now, just about, yeah?
Yep.
Wow. And how's it been for you?
Good. Every area has its challenges, but overall, KRMC is a good place to be working for, and I've been enjoying my time here.
Yeah, as I recall, you were working at a private clinic.
I had a private office downtown Kingman, and then eventually transferred over here to the hospital.
And how is the work different when you come and work in a hospital setting?
For me, it was just nice to transfer the responsibility of all the back end stuff.
For sure,
so,
right?
Don't have to talk to insurance companies anymore, that kind of stuff. So I get to focus on patient care, which I enjoy.
You don't want to talk to insurance companies? That's so weird.
Yeah.
And most doctors love that. Well, the big news in your world, in the work that you've been doing, is that you recently completed a postgraduate education course that makes you certified in sports medicine, in chiropractic sports medicine, true?
Yes, correct.
All right, so I want to talk all about that this week, but as I said, it's been quite a while since we visited. Let's talk a little bit about chiropractic in general, just for listeners who maybe only have minimal familiarity. Right?
Absolutely.
People generally think of chiropractic as kind of straightening up the neck and the back.
Yep.
Yeah.
Yep. Cracking necks and backs. That's what we get. So.
and what is it you're doing when you go through that adjustment with a patient?
So typically, what we're doing, and again, this primarily carries through most of what we do, is first off is diagnosing the appropriate injury or what's going on with the patient. Mm-hmm. Not necessarily because you go to a chiropractor, you're going to go get an adjustment. That's kind of the fun part. Some people really look forward to that.
Yeah.
But again, getting the correct diagnosis for the patient is the primary concern. So we do a thorough exam with all of our new patients, so we know what's wrong with them, and then prescribe the appropriate treatment for them.
And I understand that all patients are different, but if you had to kind of come up with a prototypical patient, probably it's somebody who's got something bothering his or her neck or back or something like that?
Yeah, we do get a good mix of patients here, and that's one thing that's kind of fun about being in Kingman is we have a wide variety of stuff we wouldn't maybe typically see in your standard big city practice. And so we get a lot of not just, oh, hey, I slept funny, my neck kind of hurts, or I worked out too hard last night and I'm hurting today. But we get to see some pretty chronic or serious illness that get mixed into our practice as well.
And oftentimes these stem from maybe some injuries way back in the past, or chronic spinal problem, or what is that?
Yeah, sometimes genetic stuff, whether it's scoliosis or multiple issues that can be formed in childhood, or whether it could be severe trauma too as well. Motor vehicle accidents, that kind of stuff, with longer recovery times.
Yeah. So again, generally people think about chiropractors working on necks and backs, and you do all of that, but
absolutely,
you can do a lot more than that, right? You can work on all the limbs, and other things can get subluxated. Is that the right term?
I try to shy away from the term subluxation, but would definitely look at all extremities, arms, legs, wrists, ankles, all that kind of stuff. Yeah. It's chiropractic is a whole body care. We definitely do get that stigma of, oh yeah, neck or back only. Like, why are you touching my elbow? It's like, it's part of you. We'll figure it out.
So if we won't say subluxation, we can say out of whack. Yeah,
sure.
Let me say that a couple of years ago, I guess it was, one day I got up, I was at home. I was not aware of having done anything particularly weird or outside of my routine, but my hip my hip was hurting, and it was weird. And I would, when I was walking up the steps, I could feel it cracking. I could feel a hitch. Cracking is not quite the right term, but I could feel a hitch in there. It was kind of a thunk, and it hurt, and it was weird. Yeah, I was over in Las Vegas, and I went and saw a chiropractor over there, and you probably know what he did.
Yeah,
he just,
little hip adjustment on it.
Yeah, gave it a little, straddled my leg and gave it a yank, and and it was better. And
Yep.
it was like, it was that easy. Yeah.
Yeah. So again, just depending on what's going on and what's happening with that hip, sometimes it's as simple as like you said, just a nice little pull on that hip, and you'll feel it shift around, and everything's better. And those are kind of the nice, easy cases we like, because one and done, and off you go. So
it's so good. You walk in with a problem and you walk out feeling better.
Exactly.
Right?
Yeah.
I have an acquaintance who was telling me, I have chronic back problems. I've had problems forever. And I said, did you ever see a chiropractor? Oh, no. And I was like, why is that?
Mm-hmm.
It's just, I don't believe in that stuff.
Yeah.
Do you still, I mean, there's so much scientific evidence in chiropractic.
Absolutely.
It's evidence-based. It's a founded science. Do you still run into that sometimes where people say that kind of thing?
Absolutely. Yeah. Still a lot of dogma surrounding, our profession as chiropractic. And luckily, working at the hospital, it's nice to be working with a team of other physicians as well that refer to us frequently. And so you'll still get those patients that come over and they're kind of, hesitant to talk. And it's like, are you comfortable being here? Or they're like, well, my primary care told me to be here, or my specialist told me to come over here and see you, and I'm not sure why. And I'm like, well, okay, here's why. Here's what we're going to do with you. And once you get talking to them and explain what's happening, then they become more comfortable with what's going on.
I guess that's it, right? If they don't know any better, it might seem mystical and weird.
Exactly.
And then it's based in science. It's based in evidence, right?
Exactly. Yeah. Tons of research now, which is why you see me working here at the hospital. Because if there wasn't the evidence to support what we're doing, then we wouldn't be doing it.
Yeah.
And so
it is scientific, and at the same time, there's a whole lot of talk lately about medicine, how medicine should be preventive, how it should address the whole person, and not just like, okay, you have this sickness, take this pill, and then move on.
Yep.
We've realized that that's not a very good model for long-term health.
Exactly. And so certain diagnoses, it's fine. Hey, got a little shoulder issue. We're going to focus mainly on that shoulder. But sometimes it is, a broader issue. A lot of people come in with neck pain and shoulder pain. So now we have to look at, not only how's your neck and back moving, how's your shoulders moving, how are your elbows moving, what are you doing with your body that's creating this disconnect. And so sometimes we have to put the work in and really tease out what's going wrong.
Yeah. I don't, with my next question, I don't want to seem insensitive at all, but we have to concede that we have an epidemic of obesity in this country.
Absolutely.
I wonder if you could talk a little bit about obesity, from your lens of chiropractic, the sort of the toll it takes on the body.
Yeah, definitely more difficult to deal with. And that's one thing, is we try to get our patients motivated. You got to take part in your own healthcare, and that's part of it. And, not necessarily being overweight, it's one part of the problem, but definitely we know with research, it's harder on your knees, it's harder on your hips, it's really hard on your low back. And then plus our lifestyles. Most people in America are pretty sedentary. So our jobs are desk jobs. Our jobs are, we don't get a lot of exercise during the day or a lot of movement. And so when we look at the combination of factors that go into that, we're setting ourselves up for chronic low back pain issues or chronic pain issues.
Yeah. This brings us to our conversation on sports medicine, and you just received this certification early this year in sports medicine. It's 300 hours of postgraduate education, and you had to write a paper and publish it, and it was a lot of work, right?
Absolutely. So it's a minimum of 300 hours.
Oh, okay.
So definitely went above that for sure.
Yeah.
But definitely not an easy task. And then having to try to complete this during, the restraints of COVID was extra difficult.
Sure.
So,
and while you're working anyway.
And working full time.
Yeah. So good for you. Congratulations on that.
Thank you very much.
What's the interest for you in that? What was the opportunity you saw, or is it a personal interest in sports medicine? Why'd you decide to go into that?
I have a personal interest in sports medicine. I like to do a lot of crazy activities myself. And so, and another bottom line too, when we look at getting additional certifications, it's really, for me, if you're going to put the work in, what's going to benefit your patients when you go into work on Monday? What are you bringing to the office that's going to be better off that you can use? And sports medicine is one of those things where it applies to everybody. Everybody moves. Everybody needs to move. And so those same rules apply whether you're an athlete or not. You can use them to your advantage.
Yeah, for sure. Right. You're not just talking about, of course you are talking about good athletes, but you're talking about we all have to lift up a bag of rice, and we all have to pick up our kids or grandkids, or
exactly
do some gardening or something like that.
We've all got daily activities we need to complete, and just because it's a sports medicine clinic or we have a sports medicine certification doesn't take away from any of our day-to-day patients.
You talked about what benefits the clinic, what benefits the patients who are coming in. If you had to articulate some of those new skills that you bring in with this certification, how would you? What are some of the things that you can do now that maybe you couldn't have done before?
Just knowledge. I mean, knowledge is power. So the more you know, the more you can hand over to your patients and say, hey, not only is this how I'm going to help you in office, but better rehab skills to give them at home. Better things to do or things to avoid while they're doing their recovery. Prevention is huge. So if we can catch it before it's a big problem, it goes heavy into our assessments, into our exam. So we're getting that adequate exam, getting the patient the correct diagnosis, and like I said, catching things before they become a big issue is very helpful too.
I wanted to ask you about prevention. I have a press release here, and it has a quote from you, and it talks about, you were talking about prevention and treatment of sports injuries. So of course I was thinking treatment, that's your job, right?
Yep.
But when we talk about prevention, it kind of harks back to what we were talking about a moment ago, sort of addressing a problem before it becomes a problem.
Yep.
What is that process like? I mean, because for a lot of athletes, they may not come in until there's a problem.
Exactly.
Right?
So that's usually how we get introduced to most of our patients is there's definitely already an issue, which is why they're coming in. But as we go through their exam, we might find a couple other issues that are going on. Another thing that we do is sports physicals here in office, and that's a great opportunity to work with kids and say, hey, this is how you're moving now, and we can catch these little deficits that are occurring and say, hey, look, we can do these 3 things at home. It'll fix that issue prior to you, having a meniscus injury or blowing out your ACL or something silly like that. We can say, hey, let's work on that hip, let's work on that ankle. And progress them through that, and they're going to be a better athlete, a better player, and they're going to prevent their own injuries, which is great. Yeah,
you said that you do some crazy stuff as an athlete, as an adventure seeker on your own, right?
Absolutely.
And do you follow sports? Do you pay attention to like professional sports?
A little bit here and there. I'm more like the non-traditional sports, so snowboarding, skateboarding. I'm an ultra runner, so long distance stuff is what pushes me a little bit. But we're rock climbers as well, me and my wife. So lots of fun stuff to do.
When you say ultra runner, how ultra are we talking?
So my latest run, I covered 250 miles.
Oh my God! In at once?
It was a 4 days and 11 hours was my official time. So
where was that?
So that was the Cocodona 250, and I ran from Prescott, Arizona, all the way up to Flagstaff.
Wow!
Yeah,
that is amazing.
Pretty epic adventure.
That is amazing. And so, how do you rest along the way? You have a team.
So I have a full crew that comes out with me. Some of that included my family, wife, in-laws, the kids came out, and then a lot of my running buddies came out to support me during that.
Yeah.
And it was, like I said, ran for 4 days, 11 hours. And I think for that total time, I slept for 7.5 hours.
So is it like when you start to fade, you lie down and sleep for 40 minutes or something like that? Jump back up and
find a comfy spot in the rocks and go to sleep.
This is amazing. This is. I won't ask you for any confessions that will put your career in jeopardy, but let me just say, I have heard some documentaries about people like there's a race that you may be familiar with. It's a cycling race that goes from coast to coast, and they don't sleep. They sleep the way you do on that, right?
Yep.
Like, half hour.
It's real bad,
get up and go.
Yeah.
And they talk about hallucinating as just a fact of
Yep, absolutely.
participation.
Yep. Once you push your body to the limit, you're in a caloric deficit, sleep deficit. Those things come in a combination, and it's not uncommon to have hallucinations while you do that.
Amazing.
Yeah. Some people strive to have them because there's some great stories about them. Fortunately and unfortunately, I guess I didn't have any on my race. Yeah. So kind of one of those where you.
I remember hearing a story about a guy who was talking about this blue light that appeared by him, and it was like guiding him through the mountains as he was riding. And
Yep.
he was talking to his team about it, and they decided to play along. Like, oh yeah, follow the light, buddy. You got it.
Yeah, right. Exactly. I heard one of it was a runner, and he was seeing rattlesnakes, and so.
That's scary.
And in the reality of where we run is a very real thing. So there's video of it on YouTube somewhere, and he's like, just inch by inch trying to walk, and he's like, rattlesnake, rattlesnake, rattlesnake. I'm just like, that'd be so dangerous, because what if there was an actual rattlesnake?
For sure. Okay, this is amazing. So that's a whole other interview that we'll have to do at some point.
Yeah,
I would love to talk more about that.
Awesome.
But it does fit in with the sports medicine certification. Here's what I'm wondering. When you're running, or when you're training, or when you see other people running, are you unable to shut off chiropractor mode? Do you see some little imbalance or somebody's gait, and you think, you can foresee a problem?
Oh, absolutely. Yeah. That's definitely one thing that's hard to shut off is anywhere you go, you watch how people walk or how they ride their bike, or, just how they move in general. Yeah. And especially while I'm running, races, it's good to occupy your mind while you're trying to push through these ultra things. So doing that is very common, to just watch how people run and say, oh yeah, your ankle's not going to be probably feeling pretty good here in 50 plus miles.
Right. Or 5 for the normal.
Normal runners, right?
So that's really interesting. So when an athlete comes in, okay, we said everybody's an athlete, right?
Yeah.
But when somebody who maybe takes him or herself seriously as an athlete, maybe a high school athlete or a college athlete, comes in to see you, are you talking about the specific movements of that person's discipline and kind of analyzing in that way? Yeah,
absolutely. So when, and that's part of the sports medicine specialty is knowing, not only just biomechanics, but sports specific biomechanics.
Sure.
So, whether you're talking pitch mechanics for baseball, or, gait for running, track athletes, things like that. Every sport has its typical, injuries, tennis elbow, golf elbow. But knowing the biomechanics behind those and why they're happening just helps us, relay that information to the athlete better, help them rehab it better, and get them back doing what they want to do quicker.
Yeah, because clearly the chiropractic needs and the ortho needs of a tennis player are totally different from those of, say, a weightlifter.
Yeah,
and the demands of what those people are putting their bodies through.
Yeah, and definitely, you load joints differently when you're weightlifting versus, swinging a tennis racket. And those are all things that come into play when we talk about the injury and how to properly rehab it.
Yeah. Years ago, I was running long distance. I was not running 250 miles at a time. I thought I was a stud for running marathons.
Hey, that's a great run.
It's a great run, right? But it's like, you do that before breakfast and go back for more. But I was running marathons, and at some point I had an injury to my foot. I had a partially torn plantar fascia in my left foot. Yeah. It was bad, man. It was a bad...
Not comfortable.
No, it's a bad deal. Initially, we thought it was just plantar fasciitis.
Yeah.
And then it was like weeks and weeks, and this thing is not getting better. And we discovered, it was actually a tear. And I saw a specialist who said something really interesting to me. She said, I've seen your type before. And I said, oh, what does that mean? She said, you're a pathological runner. You're going to run until it destroys you.
Yeah.
I think she was into tough love.
Love, right?
So when you've seen some of that, right?
Yeah, and that's especially as you start talking into more aggressive athletes or people that are more committed to their sport, it's hard. That's one of the hardest conversations we have to have with them.
They can't stop.
Is,
right?
Hey, we have to take a break from what you're doing, and they kind of look at you like a couple hours, I can go work out later tonight,
right?
Yeah,
right. Because it really is an addiction.
Yeah.
It's really like your body needs this.
Yeah. And that's, they just enjoy it, and that's their routine, and that's what they want to do. And it's their passion. And so, we try as hard as we possibly can to say, hey, what can we modify to let you at least keep doing something? And there's ranges, and sometimes we just have to say, hey, you get nothing for a couple weeks or months, and sometimes we can modify and say, hey, you can do most of your stuff, you just can't do like these 3 things. And so it's really just working with that athlete and trying to help them keep mental sanity while they're trying to rehab or fix what they're doing.
Yeah. I mean, I'm not trying to sound melodramatic, but that led to one of the most difficult times of my life.
It's hard. It really is hard.
I went from running 1,500 miles a year to walking with a cane.
Yep.
right?
And
I couldn't get up the stairway.
Yep.
It hurt so much.
It's devastating.
Yeah.
And it's, you have to, it's coming to terms with your body, and sometimes your body has limits, and it's a mental game, and that's comes with the sports specialty is part of those, sports psychology that comes with it.
There's a bit of a counseling to what you're doing, right?
Absolutely. Yeah.
So you might have said to me in that case, you might have said, okay, runner, you're not running right now. Have you tried rowing? Or would it be something like that?
Yeah. So modify, and say, hey, you can't do impact on your foot, and we need to rehab that appropriately. Mm-hmm. But hey, you can sit in a chair and you can lift some weights, or you can do some other stuff that, takes the impact off your foot while it's healing, but still keeps you active and keeps you mentally occupied while you do that.
Sure. And you might maybe discover a whole different discipline that you're into.
Yeah, might find a new passion. You never know. So, yeah.
Part of your sports certification allows you to treat patients who are dealing with a concussion. Can we talk a little bit about that?
Absolutely. Concussion is one of those huge emerging headlines in sports medicine. It's a field that even physicians continue to learn about on a regular basis. As we go through and manage concussion, before it was very subjective and we didn't know very much about it. Now we're collecting more data. There's a lot more research going into it, figuring out what's going on, what we can and can't do with athletes, and continue to progress our knowledge on that topic ourselves.
Yeah. When over the last several years, we've heard a lot more about CTE, which is the chronic, like a lot of times with football players, people who would play football, not even professionally, but just had played football for a long time, maybe in college.
Yep.
And it's a chronic brain injury, right?
Yep, exactly. So repetitive trauma leads to a specific type of protein buildup, which, again, research is still collecting, but can lead to, depression and all those things that lead to less desirable outcomes for those athletes. Right. But yeah, it's something that still a ton of research is going into, and we continue to learn about.
Yeah. I have a friend who's an old school football fan.
Yeah.
And he says, I'm just not into the sport anymore because they've changed it so much. It's not the smash mouth game that I grew up on.
Yeah.
What do you think? And I'm like, you know what, man? I hear you.
Yeah.
I hear you. But knowing what we do now, we have to change the rules. We can't ignore that.
Yeah, exactly. Right? And especially when you talk about kids, and that's always,
sure.
you can't be injuring kids and just saying, hey, smash away and
you're 12 years old.
See what happens, right?
Yeah, right.
Like that's a really hard education piece that we try to drive home. And that one of the more difficult conversations too, we have middle school athletes, high school athletes. They might be in their sophomore year and you say, hey, you might have to sit a couple games out because of your injury. And they, tears in their eyes, and they don't want to stop playing because they don't want to let their team down. But it's one of those things to say, hey, it seems like a big deal right now for you, but in 3 games, you're not even going to know it happened. Yeah. And you'll be right back playing with your buddies and your team, and you're going to be having a good time.
Yeah. Yeah, all good points, man. There's a lot more counseling than I had thought about, right?
Yeah, it comes with the area, right?
Yeah, you really have to deal with that, and especially protecting young kids who have so much ahead of them.
They don't always see the next 5 years, so you got to have to do it for them, which is difficult.
and by the way, football's changed a bit, but football's still an amazing sport.
It's still, you definitely hear, like you said, those comments. It's definitely not the same game, or they're not as aggressive as they used to be. But I mean, they're throwing further. They're still hitting hard, and it's still entertaining to watch.
Amazing catches, incredible speed, and
exactly.
For me, I can do without the head hunting. Yeah. It doesn't look good on. It's just. We're talking about somebody's career.
Exactly. Yeah. You're watching your favorite athlete go out with a, horrible knee injury or something, and they're not going to be back for the rest of the season. That's no fun for the athlete. It's not fun for the team. And it's just it's not fun to watch. But
so we evolve, we learn, we adapt, we evolve.
Exactly.
Well, Dr. Sinopoli, there is so much more to say. Our time went so fast. Let's do this again sooner than 7 years. Can we get together again at some point?
I'd be on board with that. Absolutely.
Thank you so much for your time today.
Thanks for coming out today, and appreciate your time.
That is Dr. Francesco Sinopoli. He's a doctor of chiropractic, and he works at Kingman Orthopedics and Sports Medicine at KRMC's Wallapai Mountain campus. You can reach his office at 928-263-3516. That's 263-3516. And that's the program. That is Focus on Your Health. I'm TG Lafredo. Thanks so much for listening. We'll catch you next time.